Assalamu alaikum students. My name is Dr. Atika Zahid and this is an interactive lecture where I'm going to talk about antidepressants. So let's get right into it. At the end of this lecture, you all should be able to define depression, describe the process of serotonin reuptake, describe the mechanism of action of serotonin reuptake inhibitors, and list the serotonin reuptake inhibitors as well as identify their side effects. We all experience changes in mood. Sometimes we feel happy and energetic, and other times we feel sad and irritable. Fortunately, these moods usually don't last long, and we can go about our normal daily routine. However, life is not always that simple. There are times when we might experience unusually long periods of sadness, guilt, and decreased interest in activities. This is what we call depression. Talking about the treatment of depression, it involves use of antidepressant drugs, which work by elevating levels of certain neurotransmitters in the brain. This idea led to the development of monoamine hypothesis, which states that depression results from deficiency in one or more hormones in the brain, namely noradrenaline, dopamine, and serotonin. According to their mechanism of action, antidepressants can be divided into 5 classes, namely selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, tricyclic antidepressant, monoamine oxidase inhibitors, and atypical antidepressants. In this lecture, we will only explore serotonin reuptake inhibitors. Let me explain how serotonin reuptake works within the neuron. That will help us to understand how these selective serotonin reuptake inhibitors or SSRIs work. So here we have a presynaptic serotonergic, or in other words serotonin producing neuron. Now this neuron interacts with its postsynaptic counterpart. The postsynaptic receptors of serotonergic neuron are often abbreviated as a 5-HT receptor. Now, serotonin, which is commonly known as happy hormone, when it's released, it begins to stimulate the receptors. This causes the feeling of happiness, and at the same time, they are transported from the synapse back to their neuron in a process called reuptake. It happens from serotonin transporter. As discussed in earlier slide, during depression, the release of serotonin is decreased and reuptake of serotonin is increased. This is where SSRIs come into action and they inhibit reuptake of serotonin, and they accomplish this by blocking serotonin transporter. This results in increased level of serotonin available to bind with postsynaptic receptors. Examples of SSRIs include citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, and sertraline. SSRIs are also used for other psychiatric disorders such as anxiety, post-traumatic stress disorder, and obsessive compulsive disorder. When it comes to the side effect of SSRIs, excessive stimulation of serotonin receptors may lead to insomnia, increased irritability, loss of libido, and gastrointestinal side effects such as nausea, vomiting, and diarrhea. Okay students, let's go through the important points of lectures again as a summary. We discussed how serious depression can be and how it can make routine tasks so difficult and tiresome. We understood the concept of serotonin release and reuptake in serotonergic neurons. We also discussed about the first class of antidepressants called selective serotonin reuptake inhibitors, or SSRIs for short. And how do they work to treat depression by blocking the serotonin transporter and hence blocking the reuptake of serotonin. We went through their potential side effects because as beneficial as they are, we cannot ignore the side effect they may cause. I hope this lecture was interesting, easy, interactive enough for you. Make sure to go through the chapter of antidepressants from your textbook, Lippincott's Illustrated Review Pharmacology, which was a great help to make this lecture. Thank you students for your time and attention. Thank you very much. Allah Hafiz.